Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
As the country continues to fight off the COVID-19 outbreak, the Minister for Health, Dr. Jane Ruth-Aceng, says timely decisions have been very vital.
Because it enabled us to suppress transmission, but it also gave us opportunity to prepare, to decentralize activities to all the districts, to get our health workers prepared.
But directors of both Entebbe Grade B and Mulago hospitals during the discharge of recovered people demanded for more to be done to improve the health system.
I have so many doctors in the hospital, but when we declare that we have COVID-19, the majority of the doctors took off, apart from a few.
We call upon the Ministry of Health and the government at large that in Mulago Hospital and other hospitals in this country, the time is now to prepare so that should we have bigger numbers in the future, we should be able to manage them.
From his perspective, Dr. Baterana says preparation lies in availability of resources. For example, housing facilities for health workers.
For example, we are now to construct 150 housing units, more apartments for the staffs. But we don't have capital development. The capital development is less, which they give us. And yet, all actually uniformed people are supposed to stay at a place where they work or near the place of work. You cannot say, I have got nurses, one nurse is in Bweyogerere, another one in Mukono, another one in Ruero, and you want them at night. Where do you get them? Us as leaders, we read by example. I had also to dress up and go in to treat the cases because that's really my specialty, having studied tropical medicine as well as infectious diseases.
Mulago Hospital is allocated 11 billion shillings as Capital Development Fund. However, it has since been cut by 5 billion, and this quarter, the facility did not receive this fund. This is coupled with a shortage of funds for medical supplies.
If actually Mulago was to work and give free medical treatment for everybody, including the stents we put in the heart, the prostheses, we put like the hip joints, artificial hip joint, artificial knee joint. We need about 101 billion for medicines and sundries, including all of those I have spoken about.
Uganda has not had any COVID-19 patient that requires critical care, and whereas we have some ICU beds, some essential supplies that support critical care are insufficient.
I would also say that in Mulago Hospital, we need like another extra 700 ventilators, 700 monitors, and our oxygen plant is good, but the pressure cannot fill the entire hospital.
And as he marks a decade at the helm of the national referral, he says his effort has not gone to waste. He initiated plans that have improved management and services of the health facilities whilst he headed Mulago, Chirudu, Kawempe and the Women's Hospital.
Over time, the diploma nurses have gone to school to acquire degrees. Quite a number of them, over 100 people, nurses close to 150 have also acquired degrees, and others are in school getting their degrees. That is happening almost for the first time. Also in Uganda, we are using the capital development funds, we are able to construct 110 housing units for staffs. And again, this is the first time that such housing units were constructed on the hill of Mulago Hospital. All of these to put our health sector, especially what we can't have, let's hire. Let's use the placement method. In the same way, Mulago Hospital, most of the equipment that is in the laboratory is not ours. It is on that placement method where the company brings the hospital, brings the equipment, places them there, and we buy reagents for the laboratory from the company. So this can be done for the entire country, so that we don't have a challenge with the equipment. By the way, it is much better and cheaper to have people place the equipment because they continue maintaining the equipment. Maintenance is not ours.
Dr. Baterana says the shortage of health workers, which remains a challenge, can be dealt with right from training institutions.
There is a mismatch between the training and what we need. There is a lot of training going on, but most probably what we are training in is not what we need as of now. So there is a need for us to say we want people trained in this, in that, and that's what the universities should do.
It is now up to government to see to it that the health sector gets the support it requires. For example, 15% funding from the national budget, among others. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.